This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Hey, good morning. I had a quick medical minute this morning related to vaccine safety. There's been a lot of data about vaccine efficacy and vaccine safety in the general population, but one of the initial populations that was not included in some of the initial studies for mRNA vaccines were pregnant patients. And so thankfully, we now have a pretty large study to add to that body of literature. So February 10th, 2022, JAMA Pediatrics. This is an observational study looking at a cohort of vaccinated pregnant mothers. So total of 24,288 newborns were studied. 16,697 of them had been exposed to maternal vaccination while in utero. The remaining had not been, and then they follow them up longitudinally. Median follow-up after birth for those whose mothers had gotten vaccinated was 126 days, and for those whose mothers did not get vaccinated, that was 152 days. This does not look like it includes a boosted population. This is just for initial mRNA vaccines. And then they looked at a number of neonatal outcomes. So they looked at preterm birth rates, neonatal hospitalizations, all-cause, post-neonatal hospitalizations, congenital abnormalities, and infant mortality over the period of time that they had follow-up. And thankfully, there were no statistically significant differences between the exposed and unexposed cohorts, meaning the singletons, children born to mothers who had been vaccinated versus mothers who had not been vaccinated. So obviously in the pyramid or the hierarchy of evidence, this is not a randomized controlled trial. It's not blinded, but it is an observational study, and it's a very large N, and that certainly would support the efficacy of mRNA vaccines. It seems to support the safety profile of mRNA vaccines in pregnancy and patients who are pregnant in terms of birth outcomes. So JAMA Pediatrics, good study, and that's our Medical Minute.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.